Alzheimer's disease can be prevented and reversed, and it should be a rare disease, according to Dale Bredesen, who is an undergrad from Caltech and went to medical school at Duke University, and is a postdoc at UCSF and at Stanley Prusner's laboratory, and he actually opened his own lab, and is now he was also founder the founder of Buck Institute. And so he states that this disease can indeed be prevented and reversed by showing that it's not a disease that you can just attack with only one thing and that's it, right? And so, for example, something like polio or smallpox or any type of infection, which like pneumonia, which we can target with a certain, antibiotic, for example. But unlike a pathogen, Alzheimer's is created by a bunch of different factors, like inflammation. It can be caused by a pathogen as well, maybe by a toxin, etc., etc. In fact, people in their blood markers see around 10 to 25 different contributors. And so, again, things like pneumonia, which can worsen which can worsen, of course, the immune system and all of that. And we can just target pneumonia with just one. We can just kill the bacteria that's causing it, and we're good. But with Alzheimer's, it can be due to pathogens, it can be due to glucose dysregulation, it can be due to toxins, etc. And so we need to understand that these chronic diseases are very complex, and we can't use kind of a checker strategy for a chess match. And for example, there's many things that we need to address. For example, something like methylation, and we talked about how B vitamins are very important to keep homocysteine levels low, as they can cause the inflammatory and the atrophic forms of Alzheimer's. We have to address toxins, we have to address pathogens, for example, herpes simplex, right? And then there's other pathogens like P. gingivalis in the mouth, F. nucleatum, mold, which can cause chronic sinusitis, candida, and other bacteria in the mouth like P. denticola, etc., etc. Then we also have to address insulin resistance and glycotoxicity, which we talked about how the harmful effects of glucose can be to change the structure of different proteins, even things like collagen. It can negatively affect, and especially these advanced glycation end products that can cause inflammation as well, which can obviously lead to Alzheimer's. So we have to address that. And as we saw previously also, when we have insulin resistance, we can't use insulin as a tropic factor, which supports neuronal survival in the brain. And so that can also contribute to the atrophic form of Alzheimer's disease as well. And we saw also how high insulin levels increases beta amyloid, because insulin degrading enzyme will degrade the insulin, and so it will not be able to degrade the beta amyloid, which will start to accumulate. Okay, so we have to address insulin and glycotoxicity as well. And then, of course, vascular compromise, which can lead to the vascular dementia, and people who had brain trauma as well. In fact, a monotherapeutic approach like Aricept, for example, actually works by increasing acetylcholine in the brain. But this is just one of the 36 patches, right, that Dale Bredesen showed over the past 30 years in his lab. There's a bunch more to just Aricept, which only addresses one factor. And some companies like Eli Lilly spent billions inventing those drugs, those monoclonal antibodies against beta amyloid. But that doesn't work because actually it was shown by Moyer and Rudolph Tanzi that it's actually an antimicrobial. So if you're killing an antimicrobial, right, you're not going to get results. And that's exactly it. In fact, it's a part of your, right, you have to address the inflammation. You have to address the innate immune system, which is overactive, rather than attacking the beta amyloid, which tries to protect you. So it's a protective mechanism, and it doesn't help to destroy it. And that's why there was no success for developing a treatment for this disease. And so monoclonal antibodies are great, but they should be a part of a holistic approach to treating Alzheimer's. And doctors should stop doing what they're doing right now, prescribing these monotherapeutic drugs for every single patient, right? Because everybody is different. And so that's really, really important, is to address these factors in a comprehensive model, in a systems model, whereby you fit the therapy for the patient's needs and not vice versa. And that's through a cognoscopy, which everyone over the age of 45 should be getting, right? And of course, if you show symptoms, then you should also do the MRI with the volumetrics as well. But you guys should really, check out Dale Bredeson's cognoscopy if you're over the age of 45. And that will give you a comprehensive evaluation of risk factors so you can tailor and fit in a treatment approach for your needs.